feel like, getting medical care these days is like trying to solve one of those Rubik's Cubes, but like blindfolded.
Oh, yeah.
It's like long waits. And then when you finally get in, it's like rushed appointments.
Yeah.
And then all the insurance stuff. It's like deciphering all this jargon.
Right, right.
It's enough to make you just want to stay home.
Totally.
And hope for the best.
Yeah, I think a lot of people feel that way, that frustration with the system.
Yeah, totally. But what if there was a totally different way? And that's what we're going to dive into today.
Okay.
We're looking at this clinic in Asheville, North Carolina.
Okay.
It's taking a really unique approach.
Yeah.
So imagine a place where you could have like direct access to your doctor.
Okay.
And they actually like have time to listen to you.
Right.
And they tailor like all your care to like your specific needs.
Wow.
And they're on like the cutting edge of all these treatment options.
Okay.
So that's like kind of the promise of concierge medicine.
Right.
But this clinic takes it even further by like bringing in psychiatric care, ketamine treatment, and even psychedelic-assisted psychotherapy all under one roof.
That's really interesting, combining all of that.
Yeah, so it's definitely different
than
like the traditional model. And I think what's really intriguing is this emphasis on like patient empowerment and choice.
Definitely. Yeah.
Okay, so let's unpack this a little bit, this concierge medicine thing.
Okay.
I know it's kind of been getting a lot of buzz lately.
Yeah.
But for those of us who haven't like experienced it firsthand,
right,
what does it actually mean?
Well, at its core, concierge medicine is about a direct fee-for-service relationship between the doctor and the patient.
Okay.
So you're essentially paying for the doctor's time and expertise directly.
Okay.
And it cuts out the insurance middleman.
Gotcha.
And that allows for much more personalized care.
So no more like battling with insurance companies over like what's covered and what's not. I feel like that would be a pretty appealing prospect for a lot of people.
Yeah, absolutely.
Okay.
You get direct access to the care that you need when you need it most.
Like some people just like dread going to like a doctor's office.
Oh, yeah. And this clinic totally gets that.
Okay.
They offer a choice of in-home visits.
Wow.
Traditional office visits.
Okay.
Or even telemedicine appointments.
Gotcha.
So you can choose the option that best fits your lifestyle and comfort level.
So they might actually come to your house.
Exactly.
Yeah.
Imagine a doctor who's willing to come to you.
Wow.
It's recognizing that healthcare isn't one size fits all.
Yeah, that's incredible.
Yeah. Because doctors in this model have a smaller patient panel. They can dedicate more time to each person.
Oh.
This clinic specifically emphasizes no more rushed visits.
Okay.
Promising longer appointment times where you can actually have a conversation with your doctor.
How about?
Discuss your concerns in detail, get your questions answered without feeling like you're on a timer.
Okay, that makes sense. But is it really just like having more time to chat? Like, what are the real benefits of these longer appointments?
Well, think about it this way. Have you ever left a doctor's appointment and you just felt like they didn't really get the full picture?
Yes.
Like they were only addressing the most immediate symptom, but not looking at like the underlying causes or, your overall well-being.
Totally. It's like treating the disease, not the person.
Exactly. And that's where these longer appointment times can really make a difference. The doctor has a chance to really listen to your concerns, really delve into your medical history, ask thoughtful questions that help them understand, your individual needs.
Gotcha.
And this leads to more accurate diagnoses, more personalized treatment plans, and ultimately better health outcomes.
So it's not just about, feeling pampered or getting special treatment. It's really about having the time and space to like build that relationship with your doctor where you really feel heard and understood.
Exactly.
And then you can make those decisions about your health.
It's a shift from a transactional approach to healthcare to a much more collaborative and patient-centered model.
I like that. And speaking of expertise, this clinic is very upfront about the qualifications of their physicians.
It's an extra layer of assurance that you're receiving care from someone at the top of their game.
Yeah, that's definitely reassuring to know, especially when it comes to something as complex as like mental health.
For sure.
And that brings us to another really interesting aspect of this clinic, which is their ketamine treatment program.
Yes.
Now, when most people hear ketamine, they think of like anesthesia in like a hospital setting, which is how it's been traditionally used.
Right.
But in recent years, there's been all this research into like ketamine's potential for treating mental health conditions.
Yeah.
And the results are pretty remarkable.
They are.
I've heard about this. I know it's getting a lot of attention as a potential breakthrough treatment.
Yes.
For things like depression, anxiety, PTSD, even, right?
Exactly. And what's so fascinating about ketamine is that it works differently than like traditional antidepressants.
Oh, okay.
It acts on a different pathway in the brain.
Okay.
Specifically the glutamate system.
Okay.
Which is involved in, mood regulation, learning, and memory.
So it's taking like weeks or even months to kick in like some antidepressants.
Right.
Ketamine can have a really rapid effect.
Yes, sometimes within hours
wow.
of administration.
And it's not just about like alleviating the symptoms in the short term.
Right.
Like studies are showing that it can actually help to rewire the brain.
Exactly.
And make it more resilient.
It promotes neuroplasticity and makes it more resilient to stress and negative thought patterns.
That's incredible. It seems like it could be like a game changer for people who haven't found relief with like traditional treatments.
Yeah, it really could be.
But this clinic doesn't just use ketamine for mental health.
Right.
Right. I was reading that they use it for chronic pain as well.
That's right. That's another area where it's showing a lot of promise.
Okay.
It can be particularly effective for nerve pain that hasn't responded to other treatments.
Okay. So it's really versatile treatment.
It is.
With a wide range of application.
Yes.
Yeah, I'm starting to see why they're so excited about it.
It definitely has the potential to transform the way we approach mental health and pain management. Yeah.
Okay, so I'm already seeing the appeal of this like integrated approach.
Yeah.
But I think it's time to address like the elephant in the room.
Okay.
Psychedelic-assisted psychotherapy.
Okay.
It sounds pretty out there, and I'm sure some listeners are thinking like, wait, are we talking about magic mushrooms here?
Right. It's understandable to have questions, especially since psychedelics have a bit of a controversial history.
Yeah.
But what we're talking about is a very specific and controlled therapeutic approach.
Okay.
That's been gaining traction in the scientific community.
Okay.
It involves using carefully measured doses of psychedelic substances.
Okay.
In this case, ketamine again.
Okay.
In conjunction with psychotherapy to enhance that process.
So it's not about like just taking a psychedelic and hoping for the best?
No, not all.
It's about using it as like a tool
to
facilitate deeper self-exploration and healing.
Exactly. And while ketamine is the psychedelic of choice at this particular clinic, there's a whole range of substances that are being studied for their therapeutic potential.
Oh, wow.
Including psilocybin, MDMA, even LSD.
Wow.
Each of these substances has a unique effect on the brain.
Okay.
But the general idea is that they can help patients access these deeper levels of consciousness, process trauma, and break free from negative thought patterns that might be holding them back.
So I'm starting to see how this could be like a powerful complement to like traditional talk therapy.
Yes, definitely.
But how does it actually work? What happens during a psychedelic-assisted psychotherapy session?
Well, it's a multi-stage process that starts with extensive preparation.
Okay.
So the therapist will work with the patient to establish trust, set intentions for the experience, and address any fears or anxieties.
Okay.
Then during the psychedelic session itself, the patient is in a safe and comfortable setting, and the therapist is present for guidance and support.
Okay.
The psychedelic experience can be intense, but it also allows the patient to access emotions and memories that might be buried deep in their subconscious.
Oh, wow. So it's kind of like a guided journey into the depths of your mind.
That's a good way to put it.
I like that.
And after the session, the therapist will help the patient to kind of integrate the experience, process any insights they might have gained, and apply those insights to their daily lives.
Wow. It sounds pretty transformative.
It can be.
Some people are hesitant about psychedelics because of concerns about like safety or potential side effects.
Sure.
What would you say to someone who's like curious but a little apprehensive?
Well, it's always wise to be cautious.
Right.
And it's crucial to work with a qualified and experienced practitioner.
Yeah.
This clinic in Asheville emphasizes that their psychedelic-assisted therapy is conducted by board-certified physicians who are trained in both psychiatry and psychedelic medicine. They take a very conservative approach. Carefully screen patients to make sure they're appropriate candidates.
And monitoring them closely throughout the entire process.
So this isn't something you can just like sign up for online.
No, it's very personalized,
it's a very
carefully considered treatment plan.
Gotcha. Okay, so we've talked about the potential benefits, but let's be realistic. Are there any downsides or potential drawbacks to this like integrated approach to healthcare?
Sure.
Like what about the cost? Concierge care, ketamine treatments,
right?
Psychedelic-assisted therapy. It all sounds pretty expensive.
You're right. Cost is a significant factor to consider.
Yeah.
Concierge care, by its nature, is typically not covered by insurance.
Right.
So it is an out-of-pocket expense. That being said, this clinic emphasizes transparency in their pricing.
Okay.
They don't have any hidden fees or membership requirements.
Gotcha.
It's an hourly rate for the doctor's time.
Okay.
So you know exactly what you're paying for.
That's helpful. But even with transparent pricing, it's still a pretty significant investment.
It is.
And it makes you wonder about the accessibility.
Right. Is this type of care only available to, like, the wealthy?
That's a valid concern, and it's an important conversation to have as we consider the future of healthcare.
Yeah.
It's not fair if these innovative treatments and personalized care are only accessible to a privileged few.
Right.
Hopefully, as these models become more widespread,
Right.
we'll see more creative solutions emerge to address the cost barrier and make them available to a wider range of people. The key is to be informed about your options.
Yeah.
And make a conscious choice that feels right for you.
Yeah, I like that. Empowered healthcare consumers making informed decisions.
Yes. Yeah.
But I think it's really important to have these conversations as we navigate this changing landscape of healthcare.
I agree. It's an exciting time to be exploring these new models of care.
Yeah.
And this clinic provides a fascinating glimpse into what the future might hold.
Yeah, it definitely challenges the status quo, and it opens up all these possibilities for a more personalized, holistic, and patient-empowered approach to health and well-being.
For sure.
Yeah.
You know, in a world where healthcare can often feel impersonal and transactional, having a doctor who truly listens, who takes the time to understand your needs, and who makes you feel cared for can make a world of difference.
It's about feeling seen and heard, not just as a patient, but as a whole person.
Exactly. And that sense of connection and trust can be incredibly healing.
Right.
Both physically and emotionally.
Okay, well, that's a great place to leave it for now.
Yeah, we've explored the ins and outs of concierge medicine.
Right.
Delved into this fascinating world of ketamine therapy and psychedelic-assisted psychotherapy and, you know, considered the potential benefits and challenges of this whole integrated approach.
And ultimately, it's up to each individual to decide what kind of healthcare they're looking for.
Absolutely.
There's no right or wrong answer.
No.
But the takeaway here is that you have options.
You do.
You don't have to settle for a healthcare system that feels, you know, impersonal or frustrating.
Exactly.
You can advocate for your own needs, explore different approaches.
And if you're intrigued by what you've heard today and want to learn more about concierge medicine, ketamine therapy, or psychedelic-assisted psychotherapy, there are tons of resources available online and in your local community.
Yeah.
Don't be afraid to reach out and connect with providers who are doing this work.
Until next time, stay curious, stay informed,
and
keep diving deep.